Fluid control and tissue management in fixed posture tension. So first is a cord technique of gingival retraction in which double cord technique is placed. In this double cord technique, a smaller size of cord is placed first over the sulcus in the depressed region. So this will provide a lateral displacement of the gingival tissue, followed by which a larger diameter of the gingival retraction cord, this is the second retraction cord, is placed over the smaller retractor cord. So this will again produce a perfect lateral displacement of the gingival tissue present over there in the prepared abutment tooth region. So the contraindications of the epinephrine, which is present in the gingival retraction cord, so it is contraindicated in some of the patients having the systemic conditions such as cardiovascular disease, hypertension, diabetes, hyperthyroidism, known hypersensitivity to epinephrine, and also patient taking some medications such as monoaminoxidase, tricyclic depressants, ganglionic blockers, and cocaine. So sympathetic amine, which consists of tetrahydrozoline to hydrochloride, oxymetazoline, phenylephrine, and the advantages of it is having a more acceptable pH. So coming to the astringents, its mechanism action is consisting of precipitations of proteins, inhibits the transcapillary movement of plasma protein, act as a caustics at low concentration and irritants in the moderate concentration, and it is low cell permeability agents. Next is alum, which is in potassium aluminate sulfate. It is 100% of alum soaked in retraction cords. Advantages are safer and fewer systematic effects than the epinephrine, and it has a good tissue recovery, can be placed inside the sulcus safely for 20 minutes. Disadvantages is 0.1% of crystal bone loss is present with these kind of material. So the common drugs which have been used as in the retraction cord such as epinephrine, alum, aluminum chloride, ferric sulfate and tannic acid, of which the ferric sulfate will have a good compatible with aluminum chloride and a good displacement is present, but alum which has minimal tissue loss and it has an extended working time, whereas epinephrine is good tissue displacements, there will be minimal tissue loss and good hemostasis, and tannic acid is also a good tissue response. But the most common disadvantages are associated with epinephrine is that systematic reactions are present and epinephrine syndrome is present, and some of the patients are also having some medications such as monoxidase or so allergic and sensitive to epinephrine. And associated with alum, it has a disadvantage of less hemostasis and tissue displacement, and ferric sulfate is non-compatible with epinephrine. So this is the final impression which is made after the placements of gingival retraction cord technique. So it will provide a definite margin of the prepared tooth. Next is a rotary curettage method of gingival retraction, which is in absence of bleeding on probing. Sulcus depth should be less than 3 mm and adequate keratinized gingiva. These are the indications for doing a rotary curettage. So these ideal condition system of cases, we can go ahead with the rotary curettage. So this is a process in which the burrs have been used to produce a rotary curettage and then followed by the placement of gingival retraction cord. So coming to electrosurgery, this consists of three types of some of the materials such as it is having a motor control for producing the electrosurgery, handpiece and cord, and different shapes of electrodes which is used for performing the electrosurgery for providing a gingival retraction. The mechanism of action which involves controlled tissue destructions. Current flows through a small cutting electrode and a vacuum tube or a transistor to deliver a high frequency electric current of at least 1 MHz. So the electrodes which have been used such as coagulating, diamond loop, round loop, small straight and small loop. So Oringer recommended that the grounding electrode should be placed under the thigh rather than at the back, as contact with small bony protrusion, vertebra, etc. could produce a high current density to cause a burn. So indications where these electrosurgery can be used such as are areas of inflammation, granulation tissues, where it is impossible to retract the gingiva, to enlarge the sulcus, also to control the hemorrhage, and also to remove the irritated tissue. Contraindications where these electrosurgery can't be used such as in the patients with cardiac pacemakers, TENS, transcutaneous electronervous stimulation therapy, insulin pump, and very fine marginal gingiva with or without the attached gingiva, and presence of inflammable anesthetics or agents, delayed healing due to the debilitating diseases and radiation therapy. So this is the technique which have been used to follow to produce an electrosurgery using gingival retraction using the electrosurgery. The cord has been selected, and after that 1 MHz of electrical current passage is done with the use of the motor which is present over the electrosurgical apparatus. So this is the technique which is used to follow the electrosurgery. So the technique followed, which is the electrode must be moved at a speed of 7 mm per second to prevent the lateral heat penetration, and no strokes should be immediately repeated, and at least 5 seconds should be allowed to elapse before repeating the stroke. So the sequence of surgery which has been followed such as first it started from the lingual side to facial, mesial, and then to the distal surface. So newer techniques such as Expasil paste have been used, and this is an alternative to the retraction cord. So this is a viscous paste which is placed over the gingival sulcus for a time period of 20 seconds to provide a gingival retraction. So this consists of aluminum chloride, kaolin, and excipitants. So it is mostly of flavored agents, and it is mostly available in the strawberry flavored reactions. Next is laser and magic foam has also been used as an alternative to the retraction cord or electrosurgery to perform the gingival retraction.